Hi, welcome to the question of the week. I'm Dr. Alvarez, and this week we'll talk about the differences between the gastric bypass or the Roux-en-Y gastric bypass and the gastric sleeve procedure. Now, the gastric bypass is a surgery that combines both restriction with a small stomach and malabsorptive components. In other words, it is designed to limit the amount of food you are able to intake because the stomach is reduced greatly to a small pouch, and in addition your intestines are rerouted to intentionally make you not absorb the nutrients or calories of the food you are intaking. So I will show a diagram right now so you can actually take a look at that. Today the most popular version of this gastric bypass is done laparoscopically, like the sleeve surgery, which gives the patient the benefit of a very rapid recovery. Traditional open version, open surgery is still done, but it's mostly reserved for very difficult scenarios. For example, a patient with previous abdominal weight loss surgeries, very high BMI patients, or just simply when the surgeon doesn't feel comfortable with the laparoscopic technique. Surgery, in average, depending on surgeons, in general, averages between 2 to 4 hours, and this is a procedure that is considered very safe, very effective operation, but has some disadvantages. One is weight regain. It is known that a very high percentage of patients who undergo this procedure will have some weight regain 3 to 5 years down the road, and this varies on the surgeon's technique, the patient's eating habits, among other factors. Another big disadvantage versus a sleeve is your vitamin deficiency. Patients need to take vitamins forever and ever, so since your intestines are rerouted, there is a lack of absorption in your body of the body nutrients. So patients develop some vitamin deficiencies, osteoporosis, anemia, and other conditions due to this. Now, rerouting intestines, well, that also gives you a risk of long-term risk of developing an internal hernia. An internal hernia which causes intestinal obstruction, strangulation of the intestines. So anybody having a gastric sleeve procedure, a gastric bypass procedure, will have this risk for the rest of their life. So the other risk is marginal ulcer, or ulcers in the stomach. This is increased in these patients, and it is known that several factors are known to cause this incidence. Also, the intestine is not designed to receive large concentration of sugar or carbs, so since it's rerouted, patients may develop what is known as a dumping syndrome. This is when carbs hit the small intestine, it triggers a cascade of symptoms that the patient feels. So it's they try to stay away from carbs. Some of these symptoms are mainly abdominal, to the GI tract, like nausea, vomiting, abdominal pain, cramps. Some people with this syndrome may experience some diarrhea, dizziness, they feel sometimes lightheaded, some bloating, belching. Some people feel some fatigue, they feel tired. And almost patients will complain of heart palpitations, rapid heart rate. So if we compare all this with the sleeve, with the bypass, well, the sleeve has a lot of advantages over the gastric bypass. Like it does not require any rerouting of intestines, so therefore the vitamin deficiencies or malnutrition is very rarely seen in sleeve patients. Also, this eliminates the risk of internal hernias or dumping syndrome, although there are some reported small percentage of sleeve patients that may develop similar symptoms like a dumping syndrome. but no internal hernias. The functions of the stomach are pretty much the same, since you are not altering the entrance of the stomach nor the exit. All these functions are untouched. So you'll see here at a diagram that the entrance of the stomach has stayed untouched. Exit stays untouched. So that's your own entrance and exit of the stomach. So weight loss has been described to be similar on both procedures, as well as a decrease in ghrelin, the hunger hormone. But the sleeve procedure can be done in less than an hour. Our team has an average about 35 minutes. These are just a few differences between the two procedures. Be sure to watch the video. I'll place the link here where I talk more about the gastric sleeve procedure. Just follow the link. I will send this link will send you to the other video. So I sure hope that you found this video useful. Be sure to subscribe to our channel for future videos and updates. Send me your questions, send me your comments via Twitter or YouTube here. And thank you so much for watching.